students, welcome back. Now we are going to see the azygos vein and the hemiazygos vein and the accessory hemiazygos vein, and also this posterior intercostal veins, how it is getting drained into the azygos vein, hemiazygos vein, and the accessory hemiazygos vein on the left side and azygos vein on the right side. And the first, second, third, and fourth will have some modifications in the termination of these intercostal veins. Now here you can observe this thing as, so this one is the superior vena cava and this one is the inferior vena cava. As we know that these are the vena cavas which finally drain into the right atrium. So, and this one is the right brachiocephalic vein and this one is the left brachiocephalic vein. This right and left brachiocephalic vein. Now, so these are the intercostal nerves. So this one is right side intercostal and this one is left side intercostal nerve. This is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So this is the 11th intercostal nerve on the both sides. 11th intercostal nerve. Below this one, the 12th one is called as subcostal nerve. That you people know that this one is the subcostal nerve. Okay. Here, how these are going to open. So the first intercostal nerve is draining into the, on the right side it is draining into the right brachiocephalic vein, and the left side it is draining into the left brachiocephalic vein. Okay, and next, second, third, and sometimes fourth vein and sometimes fourth vein. So second, third, and also fourth sometimes unite to form superior intercostal vein. There in the arterial supply, that is called as superior intercostal artery, which supplies first two intercostal spaces, isn't it? So here this is the superior intercostal vein which finally drains into azygos vein. So these are the combinations which are occurred in the upper intercostal veins. Here also the same thing. The left one also, the second, third, and fourth unites to form superior intercostal vein. This one drains into the brachiocephalic vein. This one also drains into left side brachiocephalic vein. But in this second, third, and fourth will drain into azygos vein. So we have seen that. So this azygos vein on the right side, accessory hemiazygos vein as well as hemiazygos vein. How these veins are formed, now we will see here. So first we will see the azygos vein. First we are going to see the azygos vein. So once you understand the formation of azygos vein, then you will understand this terminations of the remaining intercostal veins. For that reason, first you should understand the formation of azygos vein and hemiazygos veins and the accessory hemiazygos vein. So this is the inferior vena cava. So and this one is the right side renal artery and this one is the left side renal artery. Okay, so here the 12th nerve, we know that this one is the subcostal nerve, isn't it? This one is the subcostal nerve, and here this is the iliac veins. Okay, inferior vena cava, and this one is the iliac veins. From this vein there is a vein which is coming upwards, that is called as ascending lumbar vein. What you call it as? Ascending lumbar vein. So here you can see this is the ascending lumbar vein. Okay, this ascending lumbar vein, so it is coming from this iliac artery. So this is ascending lumbar vein, so which will move up also like this. So, and also another vein which is coming from the inferior vena cava, you can observe behind this vena cava here. So here you can see this another vein. So this one is called as lumbar agios vein. What do you call? Lumbar agios vein. So now this ascending lumbar vein, ascending lumbar vein, and the subcostalis vein, as well as this lumbar agios vein, all these three unite to form agios vein, and all these three unite to form agios vein on the right side. So, and which will finally terminate or finally drains into superior vena cava. This is about the formation of agios vein. Now you can see here on the left side, so the same type of formation is also seen on the left side also. So here on the left side, again left ascending lumbar branch, and left subcostalis vein, So what is the other vein now? Next other vein is lumbar agios vein, left lumbar agios vein. All these three unite to form left side hemiagios vein. What do you call? Left side hemiagios vein. This left side hemiagios vein finally terminate into agios vein only. Okay, coming to the accessory hemiagios vein is formed by the union of, already we have seen up to 4th here. It is formed by 5th, 6th, 7th and 8th. So 5th, 6th, 7th and 8th, all these unite to form that is called accessory hemiagios vein. This one also finally terminate into agios vein. Okay, in the hemiagios vein, what are the veins end up here? 9th, 10th and 11th veins will end up into hemiagios vein. Whereas in the agios vein, the remaining thing after 4th, that means 5th, 6th, 7th, 8th, 9th, 10th and 11th veins are finally end up into this agios vein. So all these drains of accessory hemiagios vein and hemiagios veins and the agios vein finally drains into the superior vena cava. So this is the mode of termination of posterior intercostal veins in the thoracic wall. So now Again we will see how it happens. There are 11 pairs of intercostal veins. On the right side, most of the intercostal veins are getting terminated or draining into the azygos vein, whereas on the left side, most of the intercostal veins end up drain into accessory hemiazygos vein and hemiazygos vein. So now you have to understand that how this azygos vein is formed and how this hemiazygos vein is formed and accessory hemiazygos vein is formed. So now first we will see the formation of azygos vein. Azygos vein is formed by a branch which is coming from the iliac vein, that is the term this inferior vena cava end up as two iliac veins. So this is giving a branch called as ascending lumbar vein. What do you call? Ascending lumbar vein. And this ascending lumbar vein connects with the 12th vein, that is called subcastalis vein, and also lumbar azygos vein. All these three veins unite to form azygos vein, and all these three veins form azygos vein. Coming to the hemizygos, in the hemiazygos also, on the left side, the branches which are coming from the iliac vein, that is the left ascending lumbar vein, and also 12th vein, that is called subcastalis vein, and another left side lumbar azygos vein. Left side lumbar azygos vein. All these three unite to form hemiazygos vein. So this is the hemiazygos vein, and this hemiazygos vein finally terminated or finally drain into the azygos vein. Okay, and this accessory hemiazygos vein is formed by the 5th, 6th, 7th and 8th intercostal veins unite to form hemiazygos vein, which finally drain into azygos vein. Okay, now how the remaining intercostal veins are getting terminated or finally drain into azygos vein, and also the brachiocephalic vein. The first intercostal vein drains into the brachiocephalic, right side brachiocephalic vein and left side brachiocephalic vein. And next, second, third and fourth unite to form superior intercostal vein on the right side, which drains into azygos vein on the right side. Coming to the left side, second, third and fourth veins unite to form left side superior intercostal vein. This one directly drain into left brachiocephalic vein, whereas this remaining 5th, 6th, 7th and 8th side on the left side unite to form hemiazygos vein, which will drain up into azygos vein. Okay, and right side azygos vein. On the right side, 5th, 6th, 7th, 8th, 9th, 10th and 11th are directly drains into azygos vein. Here 9th, 10th, 11th on the left side will drain individually into the hemiazygos vein, and this hemiazygos vein finally drains into azygos vein. So all the venous blood of all these veins are drained into the aegis vein, and this one is finally open into the superior vena cava. So this is about the venous drainage in the what you call in the posterior thoracic wall. Okay, and on the anterior side, all the anterior intercostal veins drain into the internal thoracic vein, and this internal thoracic vein finally drains into the right side, means a right brachiocephalic vein, and the left side left brachiocephalic vein. Okay, so here you have to understand one thing. If any obstruction in the inferior vena cava, there is an alternate route of venous drainage, that is through this lumbar vein and all, and through this aegis vein it drains into the superior vena cava. Okay, so if there is any problem, uh, in the draining of a superior vena cava, so there may be any blockade in the superior vena cava, what will happen? So the blood which are drained in by the aegis vein, this aegis vein again it comes back and open into the inferior vena cava, and finally it is opening into the right atrium. So there is an alternate pathways for the draining of venous blood into the heart. Okay, if there is any blockade in the inferior vena cava, so the blood passes through the alternate pathway through the this lumbar veins and all, and then aegis vein, and it is finally drained into the superior vena cava. Through the superior vena cava it enter into the right atrium. If there is any block in the superior vena cava, so alternate pathway, what will happen? This aegis vein receives the blood, and it drains into this inferior vena cava. This inferior vena cava again open into the right atrium. So these are the alternate pathways if any one of this vena cavas are blocked. Okay, this is about the intercostal veins and the termination of posterior intercostal veins. Okay, so in the next session we are going to see this aegis vein individually, and also hemiaegis vein individually and its course, and also its relations in the next video.